Hi, I'm Dr. Wade Wilde from Brewer Dental Center. I'm an orthodontic provider here in Billings, Montana, and I wanted to take a few moments to talk with you about orthodontic and orthodontic care. Specifically, I wanted to talk about three of the great options in orthodontics today. Although there are many, these are three of the more popular. In order to become an orthodontic patient, it's simply a matter of expressing your interest, finding out what your options are from the orthodontic provider, and getting some model work done is usually the first step in that. So we'll start by taking a look over here at what the models, what kind of information we get from the models. So this is a set of models that was just made up from a patient recently, and as I take a look at this information, I can find out what things need to change. I can make measurements. I can prepare for the presentation to you on the different options that might be available to you. So the model care also, it's kind of fun because at the end, this is the best evidence that you have to see where you came from, and it's kind of fun for everybody to share in that progress over time. We'll go ahead and set those aside and show you what some of the different options are. Commonly called traditional braces, but certainly there's very little that is old about them. These traditional braces give us the widest range of movement. They give us the most options, and for patients that have severe orthodontic concerns, these are still the best go-to tool and technique that we have. But there are many variations on that, and one of the variations on the traditional orthodontics is something called 6-month smiles. And this is just one variation. Many different product lines out there offer white brackets. 6-month Smiles offers white brackets and white wires, which tend to be a little bit more aesthetic and still allow the teeth to move. In particular, this product focuses on doing a short-term orthodontic care for mostly focused on the front teeth. But certainly a good option for many patients as that is their concern. And so I wanted to point that out. One of the more popular options, and again this third of the three that I wanted to present today, is a product made by Invisalign. There are other companies that also have a very good quality product along using this same kind of technique. But Invisalign uses a tray that's removable from the teeth, and these trays, called aligners, position the teeth in incremental steps. The nice thing about it, as you can see, is that you can easily remove the tray at home. You can floss, you can brush, you can eat things that are not conveniences offered by traditional orthodontics. And while you get those, or while you're getting your teeth straightened, you have those conveniences available. But as soon as you're finished with those different behaviors, then you can go ahead and reapply the force on the teeth that allows them to move. After a couple of weeks, this aligner would simply be replaced by the next in this series that progressively moves those teeth along. So very much focused on convenience, patient convenience, and certainly has a real aesthetic benefit that you can wear these throughout the day. For some patients, this is probably the thing they're most interested in, although I think it would be very fair to say that you have to keep your mind open, because all of the orthodontic options will lead to nice, beautiful, straight teeth. It's just being in the right place with the right options and having your cooperation that will make all the difference. Once again, these are just a few of the options that are available to you, but there are many. And certainly if you're one who struggles to represent yourself because you're uncomfortable with your smile, we want to help to change that. And so hopefully this gives you kind of the insight on some things to talk with your orthodontic provider about. Again, I'm Dr. Wade Wilde at Brewer Dental Center, and I'm wishing you a happy, straight smile.